Okay, settle in. This is gonna be good. Did you know nearly half of nursing students can correctly explain Orem's theory on exams? Whoa, don't worry, I'm here to save the day. In this video, we're breaking down Dorothea Orem's self-care deficit theory. You will learn how to apply the 3 core concepts to real-world examples. Plus, you'll walk away with memes you'll never forget. Trust me, 10 out of 10 would recommend. The stats don't lie. All right, let's go. Time to break it down, nurse fam. No fluff, just facts and funny. All right, picture this. You re-nurse on the floor and you have a patient who just got off the ventilator after fighting pneumonia. Your sweet patient looks like they just won the bedazzled trophy wife contest. They are covered in tubes and monitors and IVs. So you sit down at the bedside, introduce yourself, and tell them what their day looks like. You help them cough, turn, deep breathe, get out of bed, and use the bathroom. But then you stop. Wait a second. I just spent 45 minutes doing everything for this patient. What about their self-care? How are they ever going to live independently if I hold their hand through every single activity? Did I miss something? Well, you may have missed Dorothea Orem's self-care deficit theory. And she wants you to rethink your nursing approach. Uh-oh, here we go again. Another theorist, another theory, another acronym to remember. Don't worry, this will be so simple to remember by the end of this video. Are you ready? Let's dive in. Few things to remember when looking at Orem's theory. First, there are 3 big components to focus on: self-care, self-care deficit, and nursing systems. And 2, Orem was a nurse theorist from the 1950s and 60s, so you'll hear terms that were commonly used back then. Think of nurses as the medical field's social worker. Sounds odd, but stick around and it'll make sense later. Okay, challenge time. Pause this video and in the comments, describe Orem's theory in 1 sentence. Got it? Good. Let's check your answer. She thought everyone could care for themselves, but sometimes they needed help. Nice job. A plus now. Let's look at each piece of the puzzle. First, self-care. Self-care is everything we do to stay alive and healthy. Think brushing teeth, eating, drinking, sleeping, resting, bathing, dressing, etc. Self-care is also normal stuff, boring stuff, weird stuff. Like, did you know that crying is considered a form of self-care? No judgment. Whatever you need to do to stay healthy is self-care. Next, self-care deficit. When self-care is a struggle, enter the self-care deficit. This is when people can't perform self-care for whatever reason. Kids under the age of 6 cannot feed or dress themselves. People with dementia may not remember how to bathe. Post-op patients may have wounds that need special care. People with mental health diagnoses may lack insight or energy to perform self-care. Basically, self-care deficits happen when people can't care for themselves. That leads us to our last component, nursing systems. This is where we come in as nurses. Orem says we have 3 ways to help patients with self-care deficits. 1. Wholly compensatory system. We do everything for the patient. Think newborns or people who had major surgery. 2. Partially compensatory system. We do some and they do some. My favorite example is teaching a patient how to shower and then letting them give it a shot while you stand by just in case. Or helping a patient get out of bed and walk to the bathroom while holding their IV pole. 3. The supportive educative system. We teach them to do it themselves and provide emotional support while they try. We're literally their health coach in this scenario. If you're still confused, check out the table in the description. It breaks down the differences between these systems. Now let's take what we learned and apply it to a real-world situation. Meet Maria, a 68-year-old woman who has diabetes. She recently had surgery to remove a cancerous growth from her foot, and boy, does it hurt. To top it off, she can't remember if she took her insulin that morning. Let's look at how her day goes with each nursing system. Day 1. Wholly compensatory system. When Maria wakes up, she's groggy from the anesthesia and can barely move, let alone do any self-care. Her nurse, Tiffany, takes care of everything for her, including changing her dressing. Throughout the day, Tiffany also reminds Maria to eat, drink, and take pain meds. At first, Maria feels embarrassed, but Tiffany reassures her that she's there to help and that it's no big deal. As the day winds down, Maria reflects on how grateful she is to have Tiffany taking care of her. She couldn't imagine what she would do without her. Day 2, partially compensatory system. Today, Maria is feeling better. She can get out of bed and walk to the bathroom with Tiffany's help. Before leaving, Tiffany gives Maria a quick tutorial on how to change her dressing. Maria watches intently and tries to follow along, but she can only manage the edges. Tiffany steps in to finish the job, praising Maria for trying. She knows that with a little more practice, Maria will be able to do it all on her own. Day 3, the supportive vegetative system. Today, Maria faces a new challenge. She's being discharged home, but she can't return until she masters dressing changes. Tiffany sits down with Maria to review the procedure step by step, demonstrating each move. Maria repeats after her, practicing on an unused dressing. After Tiffany's patient leaves, she knows that with a little extra love and support, Maria will be able to handle anything that comes her way. That's it for this video. If you made it this far, you rock. Now pause this video and write down the main points in the notes section of your phone or notebook. Got it? Good. Let's check your answers. I bet you got it. Nursing theories can be hard to understand, but hopefully this video broke it down for you. Seriously, you're crushing this. Can't wait to see what you learn next. Speaking of next, hit that subscribe button and I'll catch you in the next one. Until then, stay safe, stay happy, and stay nerdy. Oh, and don't forget to tell your loved ones how much you appreciate them. Nurses and nurse practitioners are the backbone of healthcare. We show up every day, ready to help others, even if it means missing out on our favorite TV shows or spending less time with family and friends. And don't even get us started on the lack of sleep. Being a nurse isn't just a job, it's a passion.